Okay, Angelina, I'm going to put your hair up so that I can take a look at your spine. How does that feel? Okay. I'm going to start by palpating your atlas and axis, which are the first two vertebrae from the cervical region. Sometimes we may have some pain in the lower part of the back that originates from the neck area. There's a lot of instability going on here. Any pain as I'm pressing down on the mustard bone? No. Okay. Okay. Let me know if you feel any type of electrical stimulus going down the spine. It might feel kind of like a zipping or electrical wiring.
It just feels tender.
Okay. But I'm going to be tapping on your spine, and that's what I'm looking for to see if there's any abnormal neurological reflex.
I'm feeling something right there.
Okay. This does feel a little bit prominent. I'm going to be very gentle. I'm going to do a temperature variation as well.
Feel it.
Right here. Okay, so that's T4. I'm going to come back to this. Slight inflammation on the lumbar region. Checking for any deviations of the spine. Sometimes it is normal to see a little bit of a shift, but I don't see anything here. Let me know if you feel any type of electrical activity moving down the spine. Right here.
Right.
Now we're looking to see if there's any variation between left and right. Sometimes it could be on both sides, sometimes it could be just one side.
Right.
Variation is definitely not symmetric. But it does travel from the right shoulder into the scapula, moving down through the thoracic area, and does stop at the end of the thoracic region. Looking at the intercostal nerves and movement. Okay, very little space and not sensing a lot of flexibility. Okay, so I'm going to touch you with a soft surface. Go ahead and tell me when you feel this. Just say no.
No. No. No. No. No. No. No. No. No. No. No. No. No. No. No.
Okay, I'm going to be focusing on this side. I'm going to touch you with two textures. One is going to feel sharp. This is what sharp is going to feel like. And the other one is going to be dull. This is what dull is going to feel like. Can you feel the difference?
Yeah.
Okay. So tell me what you feel.
Sharp. 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 Dull. Sharp.
Is that sharp or dull?
I didn't feel it. Dull. Sharp. Dull.
We're looking for dull numbness, and there is a little bit of numbness in this area. Now we're going to test the paraspinal side.
Sharp. Sharp.
Okay. Now go ahead and tell me if you feel this sharp all the way.
Yeah. It ended about mid-back.
Okay. Somewhere over here.
Yeah.
Okay. Now go ahead and tell me if you feel this dull all the way.
Yeah. Yeah.
And does this feel the same on the other side as it feels here?
I feel it more on the left side.
What about now? Does it feel more on the left side than it does here?
Yeah.
And now?
That was even.
It was even. So it does stop about here and it starts about D5. Okay.
I felt it more on the left. That one was about even.
Even. Okay. Go ahead and tell me if you feel less warm or cold.
Cold. Warm.
Okay.
Cold. Cold. Warm. Warm. Cold. 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 Warm. Cold. 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 Warm. Cold.
Okay. Go ahead and tell me if you feel less vibration or just pressure.
Vibration. Pressure. Vibration. Pressure. Vibration. Pressure. Vibration. Vibration. Vibration.
Okay. Let's see. I'm looking for asymmetry. Left shoulder is more elevated at the spinal region. It's about 11 exactly. 9.4. Nine. That's 11. Okay. I'm gonna look for temperature variations in the paraspinal region. some light ankle movement there. Okay, there's a lot of inflammation in the upper region. That's where we're going to be focusing. We need to be able to increase flexibility. Slight angle movement there. And it does correspond to that line. Okay, we're looking at latitude. Temperature variation there as well. Does stop right at the end of the thoracic region. I'm going to listen to your back. I'm going to have you take a deep breath in and then exhale. Slight crackling sounds. Okay, I'm going to do a spine adjustment. Going to feel like a popping sensation. We're trying to increase the spaces in between the vertebrae. Focusing on the points that have lower variability. This increases spine mobility. It allows for smoother and easier movement. Okay, we're going to adjust your occipitus as well. And your atlas, which is the most important vertebrae, I would say. It's very hidden, right? The first vertebrae that attaches to the cranium. And touching a little bit on the axis. We're trying to relax these muscles that attach at the base of the cranium. Applying slight pressure on these points. This helps to minimize any discomfort during the adjustment. Okay, I'm gonna feel slight pressure now. Trying to activate the nerve cells. Any pain as I'm doing that? Okay. This doesn't penetrate the skin. It just activates the nerve points. That helps with muscle tension. Okay. Slightly trying to activate these points. How does that feel? Okay, now we're smoothing the muscle. It's sore. Okay. There are all these points on the spine that I'm a little bit concerned of. I would like for less fluid buildup and to be able to decrease these inflammation points. So that's why we're trying to activate the tissue behind it. Okay, I'm going to do skin pulling. This helps to increase circulation in this area. It's going to feel kind of like a pulling sensation. Okay. It's definitely more inflammation as we're going up into the trapezius. This is where the first electrical sensation happened. Okay, I'm gonna feel like a popping sensation. We're going to crack the spine. Okay, take a deep breath in and breathe out. And again, breathe in, breathe out. Okay. And again, breathe in, breathe out. I'm going to focus on the scapula. I'm gonna ask you to give me this arm. Go ahead and try to touch the middle of your chest here in the back. I'm going to press down on the middle of the palm. Go ahead and tell me if you feel any pain shooting down the spine, okay? Okay. Go ahead and keep it like that. Just sliding my hands here under your scapula. Any pain here? Okay. There's not a lot of space, so very little flexibility. I'm just going to go ahead and adjust your scapula. Keep your arm like this for me, okay? Breathe in, breathe out. Okay, let's go ahead and see how that feels. Okay, perfect. Okay. I'm going to apply an anti-inflammatory oil. It's going to feel kind of like a warm sensation down the spine. That's very normal and expected. Okay, we're going to use dry cupping now. It's going to feel like a squeezing sensation. It helps for the blood to be pulled to the surface of the skin. It helps with inflammation of the muscle. And as I'm sliding down the cup, you're gonna feel a relief. So, blood comes out, and we're just gonna drag it down. It helps with any fluid buildup. And this is where everything comes from. Kind of feel the pressure down the spine since we're trying to activate the spaces in between the vertebrae. Okay, you can definitely see an improvement in the natural movement of the muscles. Okay. There's definitely less inflammation in this area now. Just trying to create a suction so that we allow the muscle to shrink. Definitely less inflammation on the left side. Slight movement at L1. We should definitely see less fluid build up as we're doing that treatment. I'm going to work on the lymphatic drainage since there is some inflammation in this area. Just moving the lymph down from the neck region so that it gets removed through the lymphatic drainage. Very gentle strokes here, trying to activate the natural detox system. I have here warm medicine balls. First, we're going to apply pressure in the occipital area. It helps with inflammation and to lower cortisol levels. The medicine has anti-inflammatory properties. Okay, go ahead and take a deep breath in and fully exhale. Good. And again, breathe in and exhale. Okay. One more time, breathe in, breathe out. Good. Okay. Just going to do some manual adjustment here. Breathe in, breathe out. Breathe in, breathe out. Okay, we're going to do scalp therapy as well. Okay, we're going to scrape these abrasions that have been building up behind the ear. And this is a scalp treatment adjustment. It does help to lower the adhesions and allow for better movement. I'm going to do hair pulling, just moving and creating that gap allows for the tissue to regenerate. Okay. Definitely less tension. Starts to decrease. Hi, Niso.
Hi.
How are you doing today?
I'm doing good, thank you.
Wonderful. So, you're here for a chiropractic adjustment. Have you ever had one before?
I did a long time ago, but it's my first time in quite some time.
Okay. How long has it been?
I want to say about 5 years. I used to have really bad back pain, so I would go, but it stopped for a while and it started again, so I wanted to get it checked out.
Where is it located? Is it more upper, lower,
I would
mid?
say upper by like the neck and shoulders.
Okay. Yeah, that's very common. And do you sit down at a desk while you work a lot, or are you more active?
I mean, I try to stay active, but my work does require me to sit at a desk a lot.
Do you lift very heavy weights?
I do, yeah.
Okay, that definitely can contribute. But we can take a look and see what we can do today.
Okay.
Are you experiencing any shooting pain down the back on the right or left side of your leg?
No.
Okay. Any knee problem or knee pain?
Sometimes my knees will pop and hurt a little bit when I am lifting, but I just kind of ignore it.
Yeah, we definitely recommend maybe physical therapy so that we can strengthen those ligaments and muscles if that keeps on happening, because it's definitely going to tear down the meniscus and probably cause an injury if it keeps on happening. We want to make sure that we keep your spine very mobile and that there is enough space for the vertebrae to keep on moving freely so that there is not a lot of strain on the ligaments and muscles.
Okay.
Do you have any shoulder injuries or shoulder pain?
I do get like the same pain as I do in my back that comes down to my shoulders, but there's no injuries.
Okay. What about on the neck, upper?
Yeah, I can feel it go all the way up to my head sometimes.
Do you get headaches very often?
Yeah, I do.
Okay. Yeah, definitely can be triggered by the back pain. So let's get you up and moving and see how your balance is and how your muscles are aligning as well.
Okay.
Go ahead and make a few steps. Take a few steps towards me. Keep on walking straight. Okay, a little bit out of balance. I'm going to have you turn. We'll do that one more time. Okay, come back towards me again. Okay, turn. Go ahead, keep on walking. And I'm going to have you stop right there. I'm just going to go ahead and palpate your pelvis. Let me know if you feel any kind of pain. I'm looking for abnormal curvatures of the spine. Also movement of the sacrum. So palpating S1 and S2. Moving up. Okay, here we have 2 scapulas. Just slowly going to put my fingers under. Feeling for any tightness. We can definitely increase the mobility of the scapulas. Okay, so let's go ahead and take a look first at the shoulders. I'm gonna have you lift one arm up 90 degree. Perfect. Okay. Just palpating here, the shoulder joint. Any pain as I'm pressing down?
Just a little soreness.
Okay. Now go ahead and lift your arm above your head. And any pain here?
Same thing, just a little discomfort.
Okay, go ahead and bring it back down. And I'm going to have you lift your arm this way. Okay, and try to touch your shoulder with your left ear. Any discomfort here on the neck?
Just a little soreness again, but nothing.
Okay, come back to center. And we'll do the same thing on the other side. Go ahead and lift it up 90 degree with your chest. Just slowly palpating here the shoulder joint. Any pain?
Not as bad as the other side.
Okay. Go ahead and lift it above your head. How is this?
Not bad.
Not bad. Okay, now go ahead and move it away. So start at the center and slowly move it away. Good. And I'm going to have you touch your shoulder now. Good. Any pain or discomfort there? Difficulty doing it?
In the front of my shoulder, actually, yeah.
Okay, come back to center. Good. All right, I'm going to have you lay down now. I'm going to go ahead and just slide my hands under your neck, behind. Go ahead and relax. I'm just palpating to check for any tension. Feeling a lot of adhesions around C1 and C2. It's not too bad, but we definitely can loosen up some of those muscle fibers, and that's going to help with the adjustment of the cervical spine. I'm applying an anti-inflammatory oil. Okay, this is going to feel a little bit cold. Just slowly massaging the area. I'm going to increase the tension as I'm moving in. Go ahead and turn your head towards the left. This also helps to lower cortisol hormone and slow down inflammation in this area. We're going to do. Okay, I'm going to do the first cervical adjustment. I'm going to have you relax your neck. Okay. Go ahead and take a deep breath in and breathe out. Good. We'll do that one more time. Breathe in, breathe out. Good. Just doing a slow neck release here. Deep stretch. Okay, perfect. Let's go ahead and adjust your arms. Okay, go ahead and relax your arm. Just slowly palpating here on the main trigger points so that we can release the right ligaments. Go ahead and take a deep breath in and breathe out. Perfect. Now we're going to do a release on your knuckles. Right points. Go ahead and take a deep breath in now and breathe out. Okay, so just elongating those arms. Make sure that we are increasing oxygenation in the shoulder joints. Perfect. So let's go ahead and take a look at your legs. Is it okay if we take off the socks? Okay. All right. Let's see. And the left leg is a little bit taller than the right, so we're gonna have to work on those hips to align them. But first, let's increase some of that space in between the hip bones. So we're just slowly elongating your legs, making sure that you're at least 1 inch taller when you go home. Okay. To apply a little bit more oil, and we're going to work on the meridians on your feet. Make sure that we are increasing circulation and work on the lymphatic drainage as well. Okay, and go ahead and work on your toes as well. Okay, one little crack. Perfect. Alright. I'm going to go ahead and massage your upper thighs. So just slowly releasing the tension. Since you did say that your knees pop quite often, this is going to help to increase circulation in these muscles. It's also going to help with the alignment. Do you also jog?
I do. I do a lot of running.
So definitely this is going to help. Okay, I'm going to do a hip adjustment now. I'm going to have you bend this knee up and just throw it over the other one. Give yourself a hug. Perfect. And on the count of 3, I'm going to ask you to take a deep breath in. Flip yourself a little bit on your right hip. Perfect. Breathe in and breathe out. Good. Do that one more time on the other side. So go ahead and flip a little bit on the right hip. Good. All right. And go ahead and take a deep breath in and breathe out. Good. Perfect. Now you flip over on your belly and I will adjust your upper spine as well. Just slowly going to palpate cervical and sacral region. Okay. What I'm going to have you do now is I'll have you lift up one leg at a time. So let's go with the right side first. Perfect. Good. Go ahead and come back to center. And now left leg. Okay. Come back to center. Okay. I'd like to do that one more time. So right leg up. Okay. Come back to center. And left leg up. Come back to center. Good. Perfect. Okay. So your left side is a little bit tighter. Spine is going towards the right. We definitely need to decompress the thoracic vertebrae. T2, T3 definitely need to be increased in their mobility so that we can facilitate more movement. to start with gentle cupping. And this promotes oxygenation and better vascular circulation towards the muscles. Let me know if I'm touching the spine or something like that. Okay, I'm gonna have you take a deep breath in and exhale. So I'm gonna go ahead and work on the lymphatic drainage in your legs. Push the lymphatic fluid up towards the heart. I'm going to apply kinesiology tape. It's going to help to maintain homeostasis and balance on the spine, especially when you put a lot of pressure and weight on the upper back. You can shower with this. Just make sure that you dry it with a towel after you take a shower. slowly working on the scalp to release some of that tension. Alright, I'm gonna have you get dressed. How are you feeling, Miso?
I feel a lot better. I do feel nice and stretched out and just relaxed for sure.
Yeah, perfect. Just going to take a look at your shoulders from the front, okay? Definitely a lot more aligned. We're going to go ahead and just do one more session, and that should definitely help to increase mobility in your spine and make you a little bit stronger on those muscles, okay?
Awesome. Thank you.
You're welcome.
Appreciate it.
See you soon.
See ya.
Hi, Jaden. Hi. I'm Dr. Matt. I'm going to do your chiropractic adjustment today.
Okay.
Tell me what brings you in.
I have some knee pain. That's been hurting me for a while.
Okay. For how long has that been going on?
I would say like 2 months.
All right. And does it hurt all the time or only when you walk?
Sporadically. It hurts like here and there.
Okay. And does it hurt if you just sit down, for example, right now?
Kind of.
Okay.
But slightly.
On a scale of 0 to 10, how would you rate your pain?
About a 7.
Okay. And is it sharp, dull, achy?
A mix of all three, I would
Okay.
say.
And are you experiencing any other pain, like any tension in your back, neck, shoulders?
Yes, a little bit in my shoulders and my back.
Does it radiate more towards one side or the other?
The left side.
More towards the left side. Okay. Any medical history that I should be aware of? Have you had any accidents?
Yes.
Okay.
I was in a car accident long time ago that may be causing that pain now, but I'm not sure.
Okay. And have you had any x-rays or any tests to see if there is any damage to the spinal cord?
I haven't.
Okay. And you have full sensation in your arms, right?
Yes.
And you can move both arms, both legs. Yeah, you're very athletic. So,
Yes.
do you walk a lot for your work?
Yes, I do walk a lot and I do wear a lot of heels.
Okay, so that can explain the knee pain as well, plus the shoulder pain. I'm going to check for any spine mobility to see if we need to do some adjustments in the upper area.
Okay.
Also, we're going to take a look at your shoulders.
Okay.
Do you have any family history of high blood pressure or neurological disease?
No.
Okay. And are you experiencing frequent headaches?
I was before,
Okay.
but it kind
They faded away.
of. Mm-hmm.
All right, that's definitely a good sign and good indication that there's nothing neurologically happening.
Yeah.
I'm going to ask you to stand up and we'll take a look at your back and shoulder alignment, plus how you walk. I want to make sure that you don't have what's called flat feet. That can be triggering a lot of muscular problems in the body.
Okay.
All right, Jaden, so what I'm gonna do now is I'll ask you to walk a normal pace. Don't think about, how fast or how slow you walk. Just walk like you would normally walk, okay?
Okay.
Keep on walking. That's good. Come back towards me. I'm noticing a little bit of pronation on the right side. Keep on walking. I'm gonna have you stop right there. All right. So go ahead and turn to it with the back towards me. I'm just going to examine your back. Okay, Jaden, I'm just going to go ahead and lower the bands a little bit so that I can take a look at the sacral region. Slowly palpating here to see if there is any swelling. Okay, so as I'm pressing down on the right side, I'm gonna have you push with the heel in front of you just like this, okay?
This one?
Yes. Left heel, push, and come back to center. And now go ahead and do the same thing with the right foot. Perfect. Any pain here?
A little bit, slightly.
Okay, come back to center. Now, with your right arm, I'm gonna have you touch your right side of your knee.
Okay.
Go ahead. Any pain here?
No.
Okay. Come back to center. Same thing on the left side. Come back to center. Okay. And now I'm going to have you put your knee up like this in a 90-degree angle. Okay. Come back to center. And your left knee up. Come back to center. Okay. Checking thoracic area here. You said in between the shoulders you're having a lot of pain and some tension. Looking at any misalignment, honestly, it doesn't look too bad. I would definitely not recommend any excessive exercises, but we can do some mobility tests here. So what I'm going to do is I'm pressing down kind of like right here in the middle between the scapulas. I'm going to have you lift your arm up in a 90-degree with your body and keep it like that. All right. Come back to center. Do the same thing. Keep your arm there. Just
going to go ahead and slowly palpate here. Any pain?
No, not on that side.
Okay, now go ahead and lift your arm a little bit higher and come back to center. And we'll do the same thing on the left side since this is the part that hurts the most. So let's do that one more time. And now a little bit higher. Any pain there?
Slightly.
Okay, come back to center. Okay, just going to slowly palpate here. So we're checking scapula mobility. Okay, shoulders are equal. Noticing a little bit of swelling on the left side. Going to be checking cervical spine as well, starting with atlas, moving down to axis. A little bit of redness noticed here. There is normal curvature, so that's a good indication that you don't have any signs of scoliosis or abnormal curvatures. Okay, so what I'm gonna do now is I'll have you sit down on the table and I'll take a look at your neck. Okay, Jaden, I'm just going to go ahead and palpate. We're looking at the base of the skull to see if there is anything tensed. Before we do the neck adjustment, we want to make sure that the muscles are pretty warmed up and loose so that we don't cause any discomfort. I'm going to apply an oil. This helps with sore muscles, and I'm going to apply some cold therapy as well so that we can massage this area really good. Going to use cold therapy. So this is going to feel a little bit cold on the skin. going to slide my hands here slightly under your neck. So we're going to do the first adjustment. Just going to perform a little bit of traction here, make sure that we're elongating the neck. And I'll have you take a few deep breaths in here. And exhale. Good. One more time. Breathe in. And exhale. Okay, so just relax your neck muscles. And take a deep breath in again. And breathe out. And we'll do that one more time. Breathe in. And breathe out. Good. Okay. So first I'm going to just increase some of that space in between the shoulder blades. Go ahead and take a deep breath in and breathe out. Good. Okay. We'll do the same thing. I'll have you take a deep breath in and breathe out. Good. Okay. So let's go ahead and take a look at your legs here. Okay, so there's almost no difference between right and left. That's a good indication of hip balance. Just going to make some movements here. Let me know if you feel any kind of pain. Just going to slowly palpate your knee. I'm going to go ahead and just increase a little bit some of that length. Okay. Going to work on the toes as well. So let's go ahead and do an adjustment on your hips. Alright, for that hip adjustment, I'm going to have you give yourself a hug, just like that. And I'm going to have you bend this knee. Alright. Go ahead and turn a little bit on your left hip. Take a deep breath in and breathe out. Good. And we'll do the same thing on the other side, okay? Take a deep breath in and breathe out. Good. Okay. I'm going to have you flip on your belly now and I'll work on your upper spine. I'm going to go ahead and lower the beds just a little bit and I'll perform some skin pulling therapy. Okay, go ahead and take a deep breath in and breathe out. Now I'm going to have you put the legs in a 90-degree angle with your body and hold them like this for me, okay? And take a deep breath in and hold it for 3 seconds. So breathe in, hold it, and breathe out. All right. I'm going to go ahead and do a massage in this area. It's going to help to lower some of that inflammation, and I feel like it's a lot of fluid built up in here in the muscle fiber. This will definitely help to increase spine mobility in the middle region. Applying anti-inflammatory oil. It helps to reduce pain in this area. I'm going to use my knuckles to kind of increase that pressure and stimulate the nerve fiber to reduce the pain signal. Let me know if it gets too intense, okay? This is gonna feel a little bit cold. You're gonna see a little bit of redness in this area, but it will go away in about 24-48 hours. applying a little bit of massage here on the plantar muscles. It's gonna help to release some of that soreness that you're feeling in your knees. Just going to apply here some acupressure starting with the heel. It's going to help to relieve that inflammation and detoxify the body.
How are you feeling, Jaden?
I'm feeling way better.
Okay. I was able to work on the muscles right there in the middle, so
Yeah.
that's very good. And I did do a massage on the back of your knees. It's going to help a lot when you walk to not have that pressure and feel those ligaments, rubbing on each other. Cool. If you're having any more pain after this session, we can definitely go and do another appointment for you.
Okay.
All right, wonderful. It was
Sounds
very
good.
nice to see you again, and I hope you come back soon.
Thank you.
You're welcome. Okay, slight movement there.
Any pain when I press down?
No. Hi, Julia. My name is Dr. Matt. I'm going to do your chiropractic adjustment today. Is this your first time at the chiropractor?
Yes.
All right. Do you have any medical history that I should be aware of?
I think no.
Yes, no health issues. How long have you had that pain in the back?
Maybe 1 year.
All right. So anything after 6 months we would categorize as chronic pain. Have you tried physical therapy?
Maybe no. Some exercises for myself.
Okay. And the pain, does it come and go?
No.
It's constant?
Mm-hmm.
And how would you rate it on a scale of 0 to 10?
Sometimes it's 8. Sometimes less, like 4.
Okay. Yeah, that's pretty high intensity to be enduring for such a long time. Have you tried any cold or warm therapy?
Like a warm bath.
And do you know what triggers it?
Age? I don't know.
Well, no.
Actually.
Age is not an excuse to have this type of pain. So what we're going to do today is to look at your back, assess for any immobility, and see what we can adjust and what we can do to fix your pain and posture. But I do write in your file that you are working out and you go to the gym often. And yes. How is that for you? Are you able to push through? Does it interfere with your workouts?
Yeah, I think I push through. Maybe, by the way, maybe it's because of the gym. Maybe I use it incorrectly sometimes or too hard. Yeah.
Are you experiencing any neck pain when you're moving it?
Yes, sometimes. Mm-hmm.
Is it more in the back or does it radiate to the shoulders?
In the back, like here. Mm-hmm.
Okay. And are you having any pain moving up or any abnormal headaches?
No headaches.
Okay. Are you able to move both arms?
No, sometimes I can't do my homework from the right with right hand because I feel pain.
Okay.
In the back.
Any pain when you walk that shoots down your feet?
No.
Any pain in your shoulders?
I think no. No.
So it's just localized in the upper back and neck area?
Yes, right.
Okay. How many hours per night do you sleep usually?
Usually 9 hours.
That's really good. And have you had any car accidents, bike accidents?
No.
Okay. Any surgeries that I should be aware of?
Just C-section, but
okay.
It's all valid. Mm-hmm.
And when was your last checkup?
Maybe year ago.
Okay. All right, so what I'm gonna do is I will do an assessment. I wanna make sure that we find the right spot, and I'm gonna be looking a lot at your upper spine, and then I'm going to run an x-ray just to double check, make sure that everything is in alignment there. I'm gonna have you stand up and we're gonna have you walk so we can check your gait. Okay, Julia, I'm gonna have you to take a few steps, so just walk normal, don't focus on movement. All right? I'm just taking a look at your gait. Very good. I'm gonna have you turn around and keep on walking. Take a few more steps. A little bit of pronation on the right side. Go ahead and turn around. Come towards me one more time. All right, turn around. So sorry, go ahead and keep on walking. I'll show you exactly stop. It's right over there on the right heel, and I think it's connected to the lower some part of the spine. So we're looking at L1 and L2. You do have some pronation on the left side. Okay, I'm gonna have you push down with your right heel in front of you, kind of like that. Okay, so go ahead and keep on pushing. Okay, mild scoliosis on L2. Come back to center. Good. And now go ahead and push with your left side. Any pain when I press down here?
No.
Okay. All right, come back to center. Can I have you lift your knee up in a 90-degree angle? Okay, slight movement there. Go ahead and come back to center. Same thing on the left side. Okay. Definitely it's shifting to the right. Go ahead and come back to center. Just going to check for any bulging. Okay. The spine at the junction of the last thoracic with lumbar definitely needs to be adjusted because it's connected to the upper back, and I'm noticing slight asymmetry on the left side. This is also going to help with any digestion issues. Okay, so I'm just gonna slide my fingers up the spine on the upper side, thoracic, T1, T2. It's not bad movement, but definitely we would like to see more spine mobility. I'm gonna check your scapulas. Sometimes a lot of rigidity over here can determine the movement and how flexible everything is. Okay. With your left hand, I'm gonna have you touch right here. So go ahead and see if you can reach this. Okay, that is really good. All right. Any pain when I press down?
No.
Okay. Go ahead and come back to center. Let me go ahead and just find the spot right here for you. Left and right are definitely different, and slight asymmetry is expected. All right. So with your right hand, go ahead and try to touch right here. Okay. All right. So I think we have found the imbalance. Any pain when I'm pushing down?
A little bit, yes.
Okay. Go ahead and come back to center. gonna take some measurements. I want to see the degree. I'm going to put your hair up so that I can take a look at your spine. I'm going to take a few measurements to see the degree of imbalance. Okay, Julia, I'm just gonna do a few more tests here. I'm looking at your cervical spine, and now I'm gonna have you put your arm in front of you in a 90-degree angle. Okay. Right, now go ahead and move your arm above your head. Okay. Can you move it just slightly more? Okay. Go ahead and come back to center. Okay, you can move it down. And now we'll do the same thing on the right side. So first, just a 90-degree angle. Okay, now go ahead and lift it up above. Okay, now go ahead and move it a tiny bit more, almost close to your ear. Okay, so same results on the right side. You can go ahead and relax. Okay. I'm gonna have you touch your left shoulder with your left ear. Okay, let's go ahead and do the same thing on the other side. Okay, right, same thing. All right, I'm gonna have you lay down on the table. Okay, relax. Just checking the length of your feet. Definitely left is a little bit taller than the right side. Have you noticed that maybe your walking is a little bit different?
Maybe my shoes look.
Yeah, like you can definitely
different.
tell that the left is higher than the right side. Any pain when I press down here?
No.
What about on this side?
No.
Okay. I'm gonna have you push in with your heels. Okay. Now push in with the pads. Okay. I'm just gonna try to pull your feet towards me. Don't let me do that. Good. Okay. I'm gonna try to push. Don't let me do that. Good. Okay, I'm gonna have you lift your whole left leg up, and I'm gonna be pushing it down. So try to resist, okay? Okay, go ahead and relax. Same thing. Okay, you see how this side is weaker than the left side? Let's try that one more time. Okay. All right, and this definitely needs to be stronger because you're a righty. Okay, I'm gonna do a slight adjustment here, and then I'm gonna be focusing on just loosening the ligaments. I'm gonna have you take a deep breath in through your nose and out through your mouth. Very good. How does that feel?
I think better.
All right. Let's go ahead and do the same thing. I'm gonna have you take a deep breath in through your nose and exhale. Good. Perfect. After we definitely adjust your back, this is going to look a little bit better. Alright, I'm going to work on your feet first. This is an anti-inflammatory oil. It's going to help to penetrate in the muscles and ligaments. Okay, this definitely feels very rigid. We're just going to have to work on the metacarpal bones. This is cold therapy. It's going to help to relieve any inflammation that has been building up in the lower metatarsals. It's going to help to balance your gait and stimulate the spine. Go ahead and relax your foot.
Mm-hmm.
Okay, we're going to adjust your metacarpal. I'm going to have you relax. Okay, not a lot of tension in the left foot. Okay, so let's go ahead and check your arms now. I'm just gonna press down here at your acromion, just trying to find the balance, and go ahead and take a deep breath in and breathe out. Okay. Okay, we found the spot. I'm gonna have you take a deep breath in through your nose and out through your mouth. Breathe out. Very good. Okay, let's go ahead and take a look at your neck. I'm gonna have you lift your head up. Okay, go ahead and relax. Just going to feel your neck here. We're taking a look at C1 and C2. Mild dysplasia at the atlas. Not a lot of fibrous tissue building up, which is good. Is it okay if I lower the strap on the left side?
Try.
All right. Perfect. So over here, I'm just going to work on this trapezius muscle so that we can loosen it up. It's gonna help create a balance. I'm gonna use my knuckles here to just go in a little bit deeper. Let me know if you feel any pain. Just gonna slowly increase tension. Okay, I'm gonna do the same thing on the other side. If you're feeling a delayed warmth after applying the oil, it is because of the anti-inflammatory ingredient that does help to release any tension. Definitely working on the occipital lobes to break down those adhesions. Okay, I'm gonna have you come back to center. Just feeling right here, there's definitely better position at the C1. Just gonna have you take a deep breath in through your nose and out through your mouth. And again, breathe in and exhale. Okay, very good. I'm gonna have you flip over and we're gonna take a look at your back. Just checking the balance between C1 and L2. Go ahead and lift your left leg up from the knee. Okay. bring it back to center. Let's just do the same thing on the right side. And bring it back to center. I'm going to check for any changes in neurological movement. Just going to make a little mark for us to know which side we need to realign. Neurological imbalances are very normal when there is a shift. That's exactly what we're going to fix today. Okay, lots of thermal imbalance here. And it stops at T5. The paraspinal muscles are a little bit tense, so we're going to have to work on these and reduce any inflammation. I'm going to apply the anti-inflammatory oil to release the triggers and make sure that we help to detach the paraspinal muscles. I'm going to do cupping therapy. This is going to help pull any toxins that have accumulated in the muscle fiber. This helps to recirculate the blood so that the muscle can extract all the nutrients it needs for recovery. Followed by a very gentle cupping. This helps to stimulate blood flow even deeper than the superficial muscles. It's gonna feel a little bit cold, but what it does, it applies gentle pressure point therapy. It provides cold therapy to release that inflammation. Going to do skin pulling, especially in the lower lumbar and higher thoracic. It's gonna help to release a lot of tension from the spine. Good. Okay, I'm gonna have you take a deep breath in through your nose and out through your mouth. Good. One more time. And breathe out. Okay, and I'm gonna have you put your feet up in 90-degree angle. Just hold them like this. And I'll have you take a deep breath in through your nose and hold it, okay? Hold it in. Breathe out. Okay, you can relax your legs. Okay, perfect. I'm gonna have you get dressed. We're gonna go ahead and adjust your hips. I'm gonna have you flip on your right hip. Kind of like, yeah, perfect. I'm gonna have you bend this knee up. Give yourself a hug. Go ahead and take a deep breath in through your nose. And exhale. Good. And we'll do the same thing on the other side. Breathe in and breathe out. Very good. All right, I'm gonna have you sit back up. All right, Julia, how does your back feel?
I think it's better, much better.
All right.
Relief.
Go home and drink lots of fluids. Sleep. Make sure you have a light dinner. And tomorrow morning, let me know how it feels. But I would like to see you back in a week so that we can maintain that adjustment that I just did, okay?
Okay, sounds good. Thank you so
Very
much.
nice to meet you.
Nice to meet you.
Hi, Katie.
Hi, how are you?
I'm good. How are you?
I'm good.
My name is Dr. Matt. I'm going to do your adjustment today. And you've been to another clinic before, right?
Yes, I did, and the doctor I saw was kind of helpful, but the pain came back right away, and they told me to take Tylenol and ibuprofen, and I'm worried about that because of my liver. I don't want it to stress out my liver, and I just don't like relying on those things for pain, so I heard really good things about you. That's why I'm here.
Okay. So let's go ahead and figure out exactly what is going on and how long ago did this start?
So it started about a month ago. Yeah,
Alright.
and it's just pain in my kind of like mid to upper back.
Okay.
Sometimes shoulder, but I think it's all kind of connected. And yeah, in the last couple of weeks, it's just gotten really worse.
Okay, and you did have some blood work done to show that there's nothing wrong or damage with your main organs or your immune system, so that's good. On a scale of 0 to 10, how would you rate your pain right now?
It's about a 7, but sometimes it gets up to like an 8 or 9, especially at night. It's hard to sleep.
And are you taking any medicine to help with the pain?
I took Tylenol for a while, but then I stopped because I just wanted to kind of get to the root cause of the problem and not mask it.
Okay. I can definitely see if there's something muscular or a nerve damage, and we can definitely see if we can do an adjustment and figure out how we can balance your spine.
Yep.
So we're going to work on spine mobility and see if there is anything that we can do there. I'm going to have you stand up and we'll measure your gait and see exactly the balance of your hips and shoulders.
Okay.
Okay, so go ahead, Katie, take a few steps. Okay, keep on walking towards me, turn around, and walk again. So I'm seeing some pronation on the left side, turn around, and come towards me. All right, so there's definitely an imbalance in the shoulders. You are sliding about 10 degrees towards your left side. So that tells me that there is a compensation for the right side here. I'm gonna have you lift your right leg up and try to form like a 90 degree with the knee. Perfect. Put it back down. And you can do the same thing again on the other side and put it back down. Definitely here on the right side. Go ahead and push with your heel in the floor. You can choose any side. Okay, and the same thing with the other foot.
Okay.
Alright. Okay, let's go ahead and try to touch your right side of your knee with your right hand. Any pain here?
A little bit, yeah.
Alright, same thing on the other side. What about here?
Not as much.
Alright, go ahead and turn around. Let's go ahead and check your back.
Okay.
Any pain as I'm pressing down here?
Yeah. Yes.
It does feel a little bit hard, which tells me that there is some muscle fibrous tissue building up. Alright, we're going to check scapula mobility, slight angle. It's a little bit more elevated on the left side. Same, so we're going to have to work on the scapula mobility. I'm just sliding my fingers on the side of it. And I do feel some popping sensations, which really indicates that there is some fluid, free fluid there. Okay, go ahead and lift your left arm up 90 degrees with your body. Go ahead and bring it back down. Okay, and now lift it up to the side, creating a 90-degree angle here. Definitely. How is that? Any pain?
Yes. Yeah.
All right, bring it back down. We'll do the same thing on the other side. So first in front, creating a 90-degree angle. Okay, put it back down. And now to the side. Okay, go ahead and relax. Okay, so go ahead and try to retract your chin in. Perfect. Any pain as you're doing that?
No.
Okay, go ahead and bring it back to center. I'm going to have you do that one more time. Any pain here?
Yes.
All right, back to center. Go ahead and do that one more time. Any pain?
A little bit. Just
All
where
right.
you're touching right now.
Okay. So we're gonna go ahead and lay down, face down.
Okay.
Okay, Katie, I'm going to do a series of tests here just to see the balance between cervical and lumbar area. Research shows that there is a huge correlation between the two, and when they meet, kind of like in the middle where the thoracic area is, that's where people experience a lot of pain. So I'm just trying to see if there is anything that we could do here as well. Can you go ahead and lift your right leg up straight? There you go. Perfect. Higher. All right, bring it back down. And now left. All right. Bring it back down. I'm going to apply some oil and I'm going to try some cupping therapy. It does help to break down inflammation and increase circulation in this area. You're going to feel kind of like a warm sensation. It is infused with anti-inflammatory herbs, and it does have some menthol base. Okay, this should not hurt at all. And actually, it does help to release some of that fluid that is accumulating around the paraspinal muscles. It also does help to increase mobility in the area. The main adverse effect, I would say, it's some redness that definitely goes away. And the redness is just blood being pulled to the surface. And that blood may have some toxins that actually are beneficial to be eliminated through the skin. Okay, so as we're leaving these on, let's go ahead and work a little bit on the lower body. Applying gentle pressure. Just want to make sure that we are putting more pressure on the circulation. That helps to remove the fluid that has been building up through the muscles. Okay. So go ahead and lift your leg up one more time. Definitely a little bit softer. Put it back down. And on the other side. Okay, perfect. Go ahead and relax. So it's perfect that we are removing these. Okay. I'm going to work on the lymphatic drainage as well. So just pushing all the fluid towards the neck area. This helps to alleviate some of the tension that you're feeling in the back. Applying some oils on the soles of your feet. We're also going to work on decreasing lymphatic fluid in this area. And we're going to do an adjustment as well. First, we gotta make sure that we are reducing some of the fibrous tissue that has been building up. Applying some gentle pressure here. We're also going to use some acupressure. Okay, so let's go ahead and do the same thing on the other side. And we'll leave these
It's really good.
Okay. It's going to feel a little bit cold. Gently applying increased pressure. Let me know if you feel tension or tenderness. Let's go ahead and try to take a deep breath in on the count of 3. 1, 2, 3. Good. Now go ahead and lift your legs up, bend them at the knee, and keep them like this. And hold your breath on the count of 1, 2, 3. There you go. Perfect. Go ahead and relax your legs. Okay, and now I'm gonna have you get dressed and we'll work on your neck and shoulders and neck. I'm just going to slowly palpate the neck area just to see how much mobility you have here. Okay. So what we're going to do is on the count of 3, I'm going to hold your full neck weight in my hands. 1, 2, 3, and take a deep breath in and breathe out. Very good. And we'll do that one more time. Take a deep breath in and breathe out. Very good. Let's go ahead and check your arms. All right, 1, 2, 3. Perfect. Okay. Go ahead and take a deep breath in and breathe out. Good. Okay, go ahead and give yourself a hug. Perfect. I'm gonna have you bend this knee up. All right, 1, 2, 3. Breathe in, breathe out. Good. And we'll do that on the other side as well.
Okay.
1, 2, 3. Breathe in, breathe out. Perfect. All right, let's go ahead and try to elongate your legs and make you look a little bit taller.
Okay.
All right, so that's good. Perfect. Great. All right, I'm gonna have you stand up now.
Okay.
Perfect. So let me go ahead and take a look at your shoulders one more time. Go ahead and turn around. Okay, we're going to set you up with some insoles for your feet. I did notice that you're pronating your left foot, so that's going to help with posture and also walking. All right. Do you have any questions for me?
No, I feel so much better. I don't know what you did with the cupping and the massage gun, but I just feel like there's a release of tension, and I'm just feeling like my posture is even better, which I wasn't expecting.
Definitely, we were able to increase some of the mobility, and because of that, you're going to feel a lot looser in the back area. Just try to keep it that way, and whenever you're performing any new exercises or new activities, just try to engage your core muscles. That will help to keep the back a little bit straighter.
Okay, thank you so much.
You're welcome.
Okay.
It was very nice to meet you again. I will see you back soon.
All right.